Hello everyone, myself Diksha Joshi. I think we can start now. So, myself Diksha Joshi, and I'm a counseling psychologist at Conscious Mind Solutions. And today we are all here to attend the webinar on eating disorder. So, first of all, thank you so much for joining in. And can you guys please tell me, who all are from non-psychology background so that I can, uh, you know, take this webinar a little non-technical so that you all can understand. You can raise your hands, those who are from non-psychology backgrounds. Okay. All right. Okay. And rest others are all from psychology backgrounds. You can switch on your video if you want, and you can also introduce yourself in comment in chat box so that I can know are you a student or you are working or are you pursuing your bachelor's, master's, anything. All right. Now I'm presenting. Okay. Thank you so much who all are responding. Thank you so much. Okay. All right. Thank you. So I'm sharing the screen. So do let me know if you can, see my screen. Now, is my screen is visible to everyone? Okay. All right. Okay. All right. So we can start now. So here is a topic of eating disorder. Now, first we will understand what is an eating disorder and about then we will go in depth, okay? So what is an eating disorder? We will take this webinar, we will engage because you guys also are pursuing psychology, so you can also engage, and if you have any doubts, we will carry the doubts in the last 15 minutes. Till then, you can also add your points if you want to. You can raise your hands. I will ask you also. So you can raise your hands also, and you can also be a part in this webinar. It is not like that, I will be will be the speaking in this. So yes. So first is introduction of an eating disorder. So what is eating disorder? These are serious health that affect our both physical and mental health, right? In these conditions, what happens is, like, you think about the food and eating and about weight gain, and the eating disorder is, impact your whole, not even just your mentally, it is affects you physically also. And the way you think, the way you see yourself, right? These are the things which we carry on, and these symptoms can affect your health also, your emotions, your ability to think, your ability to function properly in your life. Okay. So if eating disorder is not treated properly, this disorder can cause, many long term problems, like death also in severe cases. And so in we have to, when people individual involve too much of food and focusing too much on food, and emotional eating is also present in eating disorder. And they are more concerned about their body, like, how am I looking, what people will think about my body. So this way it impacts, and this is how people starve themselves in, when they're suffering from eating disorder, to look more, you know more thin, like and majorly many models and, many actors have developed eating disorder. Like one of the famous actor, Hollywood actor, which she suffered from eating disorder, is Lady Gaga. She has also openly talked about it. So eating disorder not only, affects your physical and mental, it affects your whole life. Like it can you know physically affect your heart, digestive system, your bones, your teeth. Because when we are not taking proper digestive, proper nutrition, so it will impact our body, right? First it will impact physically, that we are not taking proper nutrition, we are not taking care of our body, we are just starving ourselves, right? And due to this starving, we it is causing many issues in our body, like, whole digestive tract is not well maintained, your heart rate, your teeth, your bones, because body is not getting the proper nutrition which is required for the body. And when we are there are particular set of calories which we have to intake in our, whole day, but we are not presenting, we are not setting that needs. So we are, just starving, and these needs are not meeting up. So then our body gets declined, and it also affects us mentally also, right? Okay, so anybody wants to add something in this? Anybody has anything which you want to add, or your point of view, or we can move ahead? Okay, so Pragati has raised her hand. Yes, Pragati.
One thing I would like to add is that eating disorder involves not only under eating but
Hmm.
also overeating.
Yeah, right. Correct.
Yeah.
Yes. Okay, right. Anybody else, or we shall move to the next topic? You can just thumbs up so that I can, go to the next topic. Okay. So now there is a types, because we know uh, eating disorder has three types. So first we have is anorexia nervosa. So, what is anorexia nervosa? It is an eating disorder characterized by abnormally low body weight, intense fear of weight gain, distorted perception of weight, and people with anorexia place a high value on controlling their weight, shape, and using extreme effort that tend to significantly interfere with their lives. That means people who are suffering from anorexia nervosa, they are, extensively doing exercise, and, not maintaining their body weight, and they have distorted perception of their body, right? They think they are not fit, they are not, there's something wrong in their body, they continuously think that there's something wrong in their body, and they try to, lose their weight. And they are already on low carbohydrates, low calories, but they still do heavy exercises to meet the needs, so that they can look fine, they can look, thin, and they can look perfect. And to prevent weight gain, they continue losing weighting, right? Continue losing weight. And people with anorexia usually, severely restrict the amount of food they eat. That's what I said. They limit their, if an individual, adult individual, should take at least 2500 calories per day, so they are hardly taking up the like 1000, right? And with that addition, they are also doing rigorous physical workout. When you're not taking the calories and you're still doing rigorous exercises, then it takes toll upon our body. And with this, they usually vomit also, by if they are eating too much, so they do vomiting by the help of laxatives. So they misuse the laxatives and diuretics, enemas. So they may also try to lose weight by exercising excessively. No matter how much weight is lost, people suffering from anorexia, they have fear that what if they may gain weight, or they have continuously, they have like they're checking upon their weight regularly, like what if I gain weight, on what will happen. They have constant fear of gaining weight. And it is generally not about food also, it is extremely unhealthy and sometimes life threatening also. So they try to cope up with emotional problems also, because people suffering from anorexia also suffer from anxiety, stress also, due to they have also body image issues because of that. Because they have listened so much, and they have, because the way they are thin, they think that being thin is more perfect. And so they always try to doubt their self-worth. They think that if they are perfect, thin, they will be able to look good, fine. So like this is one of the a picture I found. See, she's already very thin, but she's still doing workout, and there's something written on that, I think I'm putting on weight again, I would better skip dinner tonight. So see how beautifully they have you know uh, we have conveyed this key, like she's still doing exercises, she was already thin, and you can see her muscles are pulling, and her bones are showing up, but still she's planning to skip her dinner. So this is how anorexia nervosa is. So next type is we have warning signs. What are the warning signs? Because we have to take care, we never know, because mental health is that issue, we can never know who is suffering from it. So eating disorder is also like that, we can never know that who all are suffering from eating disorders. So there are many warning signs which are present, so that you all can figure out, and you all can see who are going through this disorder, through this illness, so that they can seek professional help, right? So first we have distorted body image. They must be having the individual who are having uh, falling from like anorexia nervosa, they must be having distorted body image. They have fear of gaining weight. There is quite there is a thin line between normal and abnormal, so we have to see, okay, gaining overweight is like gaining weight before normal is like you can think about it gaining weight, but you're already very thin and still you're still fearing about gaining weight. So this is alarming. Third is preoccupation with weight, calories, food, like always juggling up with how many calories I have to, how I have to take, and I have to do exercises. So these are the things you can see if your friend or family member suffering from anorexia nervosa. So these will help you out to figure out that are they really suffering. Next is food rituals, like how they are they skipping meals, are they eating way too less, are they denial of hunger is also there, like are they denying that like bhook nahi hai, it's, or it is something like they're skipping 3 course meal in a day. So we have to also look into that, and how much they are eating, and is there like significant changes in weight, are there any changes in weight also. So these will help you out to figure out that if a person is suffering from anorexia nervosa. Okay, next. Next, we have bulimia nervosa. Bulimia nervosa is our second type of eating disorder when where someone has regular episode of binge eating. Binge eating, what is binge eating? Consuming large amount of food in a short period of time. Like people usually, just take up many calories in a short period of span. Like if a person is usually spending, like we adults are generally spending 2500 calories in a day, but this person is spending like 2000 calories or 1500 calories in like one meal. So this can also be, you can see, so people who are suffering from bulimia nervosa, they usually binge eat, consuming large amount of food in short period of time, and followed by purging is getting rid of calories. And how they getting rid of calories? By, self-inducing vomiting. They usually vomit out the food. Because for people, if because in bulimia nervosa, what happens is they are they do, like, eating everything, so they do eat it, but then they regret it, and then they usually do what is self-inducing vomiting due to help of laxatives and the present laxatives and diuretics, insulin. They misuse these drugs. So these cycles usually occur at least once or 3 months or more. And if a person is struggling with bulimia nervosa, person may purge via once or several use of methods. Laxatives and diuretics are these methods with the help of people, and those who are suffering from eating disorder. They usually misuse these drugs, and they induce vomiting, self-induced vomitings. And they may use other ways to get rid of yourself, like, they try to prevent calories, they try to prevent weight gain, such as fasting, strict dieting, exercise, and they do excessive exercises, right? So there's a difference between anorexia and bulimia nervosa. Is bulimic person will binge eat, and whether the anorexia nervosa will not binge eating. The rigorous exercises between both will be the same. And it is common for those who are experiencing bulimia nervosa to have negative body image issues, like, about their body size, about their body weight, about their shape. So they have their, they this impacts them, like, mentally also. So many individuals who experience bulimia nervosa also struggle with many conditions such as injury, substance abuse, impulsivity, because they're already, not consuming enough food, enough calories. So this also take up toll on their mental health also, and this get into depression, get into substance abuse and impulsivity, self harm. This issues also, takes toll on their mental health also. So these things comes with all the bulimic nervosa. So anyone wants to add something, they can add, they can raise your hand, anyone, or you can just add in the chat box also. Anyone wants to add, or we can proceed with the next slide? Okay. I hope I'm getting clear to you. Was I clear? Anything else you want to ask? We will carry in the, in the last 15 minutes. And if you want to add something, you can let me know in the chat box. Okay. So, see, so yes, the cycle of bulimia nervosa. What they do is binge eat. First, they binge eat, and then they do self-induced vomiting, as because, they are doing it, like, and then they again binge eat the food, and then they self-induced vomiting, so that they eat the food, and then they do vomiting, so that they can, they don't carry the weight gain. They don't, because they also have fear to, they don't carry weight, they don't put on some weight because they want to look good. So in bulimia nervosa, what two things are: self-induced vomiting and binge eating will be present. Okay, so warning signs of bulimia nervosa. So these, okay, Pragati has raised her hand. Yes, Pragati, do you have anything, or okay? So Warning signs are always there in bulimia nervosa. First is binging and purging. uh, as we as individuals, we have certain amount of uh, diet. We have like some we have different set of diet. We all are individuals, so we have different set of diets. But some people are binging. They are eating more than they usually do. So this is our risk factor which you can look for, that this is a warning sign that this person may be suffering from bulimia nervosa. They are eating way too much more than their diet, and then they going up to the washroom. This is the second warning sign that you can look for. Just after eating, they usually go to the washroom to vomit out, so that they don't put on some weight due to what they have eaten, what they have binged. Okay. Second is second warning sign is weight fluctuation. Their weight must be fluctuating because they are binge eating, and then they are purging, self-induced vomiting. So these things will be present. Their weight continuously fluctuating. Third warning sign is that secretive eating. They do secretive eating because they think that people will judge them too, because they are eating way too much, because they do what they do is binge eat. So they have fear that people will judge them as they are eating way too much. And then they do secretive eating, so that nobody can know that they are binge eating. And then they do purging also. Fourth, we have abuse of diet pills, diuretics. They do misuse the pills, and for to induce self induced vomiting, they consume these type of diet pills. Next is sense of lacking control over eating. They literally lost control over eating. Like because they usually binging, they are not eating for the sake of calories. They just want to binge it. Binge is like eating 2 3 times more than your diet, and then they do is vomiting. So you have to figure see these warning signs. Are there these warning signs present in any individual near your, maybe your friend or your family? So you can seek out for professional help. These are the warning signs for bulimia nervosa. All right. Third, we have third and the last type, we have binge eating disorder. Earlier we have only two, anorexia nervosa and bulimia nervosa. This has been recently added, like binge eating, because some people do binge eating. Okay, there is a question: why is a person of bulimia has no control over eating, like anorexia person, and in both cases of weight gain is present? Because in bulimia, bulimic person will be Pragati has asked this question. I can You can all see in chat box, she has asked one question. So in bulimia there is a fear of in anorexia there is a fear of weight gain, and in bulimia there is binge eating. So because they want to also enjoy their food. They don't want to just doing exercises, or just don't want to consume. They also want to enjoy their food because they cannot control that, right? Because there some people do like food, some can control it. So bulimic person, they do like food, but they don't want to gain the weight. So they do, what they do is that they eat binge eat the food, and then they do self induced vomiting, so that they don't gain the weight. They also have fear, but they the methods of both anorexia and bulimia are way too much different, because they both have fear. But bulimic person will have they will do eating and then purging, but anorexic people will do only exercise and they do fasting, not like binge eat like bulimic person. So this is the difference. I hope I am clear, Pragati. All right, then we can move with third. We have third type, binge eating disorder. In acronym, this is called as BED, BED. So people who experience from binge eating disorder, they experience recurring episodes of overeating, like overeating like in a rapid manner and in a short time of frame, which is also present in bulimia nervosa. Same, binge eating is also there in binge eating disorder. So these episodes usually occur when they are not hungry, and they extend to past the point of a person reaching extreme fullness. They, what they do is they just eat and eat and eat, and till then, they are extreme full. They are, because their calorie is already full, but they still do overeating. And people who struggle with this disorder may feel they have no control over their eating habits during an episode, because they think, eating is the only solution, because somehow they do is emotional eating. Because you may be knowing, or maybe we all, some do, we all do emotional eating. Some people who are angry, who are, little aggressive, they do eating because eating makes them comfort. Food makes them comfortable. They just lift their mood up. And some people eat food in when they're happy, like when they're happy they want to eat some sweet. So this is how emotional connection is made between eating and our, between, our food and our emotions. This is what we call emotional eating. There's a set of pattern which is made. You must be knowing some people, or you must be also doing this thing. So this also, in binge eating also, people develop some emotional connection, but they can't control that, and they, what they do is they binge. We, as we don't binge it. We know that, we are that we are full. But binge eating people who are binging food, they don't get that they are full. The calories have been, like they should stop now. They don't have that control which we have, right? We know when to stop, but people suffering from binge eating disorder, they don't know when to stop this. So they continuously eat and binge the food. If someone is struggling with binge eating disorder, then it is common for them to have binge eating episodes, which make them distressed and followed by shame of guilt. Because obviously, when people are, binge eating continuously, so they do have, there's shame, there is guilt, and there is depression also. With shame and guilt, there comes depression. They may be feeling, that they are binging because when they're binging, there is a, obviously there will be a increase in weight, in their weight. So they have their body image issues also. And this takes up their mental health also, that they are suffering from stress, depression also. So there are people who are suffering from binge eating disorder, they have episodes like in 3, for like 3 months or longer also. Unlike other forms of disorder, people who have binge eating disorder do not usually use inappropriate or unhealthy weight to, control tactics such as fasting or purging to counteract the binges. Like in bulimia, people are binging, but they were also inducing self-inducing vomiting. But in binge eating disorder, who are suffering from this, they usually just binge. They don't do exercise, or they don't do any vomiting also. So this is the difference between bulimia and binge eating disorder. They just consume calories again and again, because they find, comfort in their food, and they do emotional eating also. So this is how it impacts their cycle. And they usually have some episodes like they are eating like they are like eating non-stop. They just don't know when to stop and how to stop. So we have our warning signs of binge eating disorder. First is restrictions. Like BED has a restrictive eating disorder. This cycle of restriction and binging leads to physical and psychological problem. Because obviously when we are binging again and again, this will also impact your physical health, and physical health will also impact your mental health, because you will be more concerned, you will be more thinking about your body weight, because the body weight has been rapidly increasing because you're binging so much. So it takes upon their health, both health, mental and as well as physical. Second, we have warning signs. They lack sense of control of overeating, because they usually don't get it, when they want to stop, when they have to stop, and they just usually do what they do is overeat. They just lost the control of like, eating, when to stop this. So they continuously eat it. Self medicating with food. The people who are suffering from, BED, they usually have potential, they must be having some traumatic life events in their past, from which they have developed this disorder. There must be something, which can be anything, must be, can be, like any traumatic event which you can think of. This lead to their comfort in this food. Next is their secretive eating also, which was present in bulimia also. Secretive eating, that, so that people won't judge them, they usually eat secretively in their room, so that, nobody can judge them, nobody can see them that they are eating. Because somehow, be as, friends or families, we usually taunt our friends or family member that, they are eating way too much. So this, they don't want to listen those things, so they do that, what they do is secretive eating. Next, we have eating large quantities of food, like if for a short period of time they eat large amount of food. And like normally they, that is not feasible for them also, but which they do that, because due to some emotional they are feeling. If a person is, feeling so low and sad, then they do is emotional eating. This is how binge eating disorder develops. Feeling of shame and embarrassment, struggling with, those who are struggling with, binge eating disorder, they have a feeling of shame, guilt, and this leads to depression also. So this is taking toll up on their mental health also, that they are suffering from depression also. Because with physical issues there comes mental issues also. So both the things will be get impacted. All right. So before moving forward, anybody has any question or anybody wants to add in this, they can add. Yes, Pragati.
I would like to ask that in this binge eating disorder or bulimia nervosa, why is there no control over eating? Means, what is
Hmm.
the reason or what is the psychological
Hmm.
derangement which leads to the feeling that they cannot control the
Hmm.
eating impulse?
Okay. Okay. Thank you so much for asking the question. Okay, so what happens in, like I've said, in binge eating and in bulimia nervosa, you have, they have little, they have developed some traumatic experience. Like I remember one of my client was suffering from, binge eating disorder. She has lost her mother back then in COVID. So she has developed her comfort in her food, that, she likes to eat lots of sweets, lots of chocolates, and she just enjoy her time, and she used to do secretive eating. And she matlab, like they do have, develop some connection with the food. And they have, like in binge eating, they do have some traumatic experience in their past. Then they don't have, sense of control over their eating. They don't, they just eat because they think that, because people usually judge them, and they fed up of these all these body image issues also, and they're already suffering from so much. So they find comfort in their food. So they just lost all the control over their, food. Like they just lost control, so they just eat. And like in bulimia nervosa, they just do vomiting. But in binge eating, they don't do things like vomiting or physical exercise or fasting. They just binge it. So this is how they lost control. And they just develop a emotional connection. First is emotional connection, and in binge eating, there must be some traumatic experience which has led to this develop this disorder in them. So these two are the main reason which why they have lost control over their food. They just don't count like how many calories they have took. So they try to ignore those facts. Like my client have discussed that to me, that she told me that she usually lost control over it. Like she doesn't know when to stop it, how to stop it. She just enjoyed that period when she eats in her room quietly. So this is how it goes. I hope I am making any sense to you, Pragati.
Yes, I understood this part, that there is an emotional connection formed
Hmm.
with food, and there is a traumatic event. There is
Yeah.
always a traumatic event lying in the background. Uh, but it raises another question in my mind, that what is the reason, or how is the emotional connection is formed with the food? I mean to ask that, in a to cope up with any traumatic trauma or stress, we have different mechanisms, several mechanisms.
Right.
So how does, in this case, that means the mind receives food as the comforting zone, and nothing, someone find music as the comforting zone. So means, what is the factor which decides that whether the food will be the coping mechanism, or the music will be the comforting source, or something else? How is that decided?
Right. Okay. That is a good question. For that, I would say, we are different individuals. We do different. We have different liking and disliking. So there are some people who develops emotional connection with food only because and they usually tend in food generally. They usually tend to eat junk food, or they eat too much of sweet, because sweets are. There's a receptor which feels we feel they release dopamine in our body, so we feel good whenever. Why there is so much, like we have to eat sweet after a meal? There's a reason for that. Why? Because we feel good after eating it. We Because our body releases dopamine after eating sweet. So this is the main reason for it. And junk food, or spicy food also tends to release dopamine also, because we enjoy that eating part. And because some people do like more of music or dancing, they tend to focus more on eating, because they just obviously love the food, which is first factor. And second factor is sweets are helps healing us. There have been studies also that sweet foods are do help us. And they we feel good also, right, after eating sweeteners, anything related to sweets. So this is also the reason. That is why majorly those who binge eat, they usually eat sweet foods because of release of dopamine in our body. So they do feel good, and in that period of time they just forget everything about anything, and they just focus on their food, and they feel happy while eating. So this is the reason for that.
Thank you, Diksha. Thank you very much. You cleared my doubt completely and very well.
Okay. All right. So we will move forward. Next, we have factors. What are the factors which can cause, eating disorder? First is biology. Some people in biology, we have three main reasons. First is genetics. Second is inflammation and infections. And third is microbiome and gut health. Genetics, through there have been history of genetics, or maybe parental history, or your grandfather, your grandmother suffering from eating disorder, anything. And it can be also be inflammation and infection in your body, which is already related to your biology. There is no control, which you cannot do anything in this. And third factor is microbiome or gut health. Your gut health is not fine, so you will be developing the eating disorder. Next, we have psychology. uh, it has three factors. First is perfectionist tendency. Some people do have their tendency to look perfect all the time. They do think that, being thin, being slim, they will look fine, people will get attracted by them. So they have these type of tendency, we will look just perfect. Second factor is that concern about body image, continuously concerning about body image issues. And body image issue also have been risen up through the social media also, because by looking up the influencer, we just follow social media people all the time. By seeing actors, by seeing models, we just get influenced that they look just perfect every time, but we don't know the back of the reality. So we always try to copy them, and we just due to this we develop body measures that we are not looking perfect like them you know so this is the issue. Third point, psychological factor, is OCD thoughts and behavior. What is OCD? Obsessive compulsive disorder is a disorder in which people have thoughts, rigorous thoughts and behaviors, which will impact their behavior also. So this is how it impacts psychologically. These are three factors which impacts our which will you know add to your, which can develop an eating disorder in one individual. Next, we have social factor. First is cultural beauty standards, because we have so much of different culture. We are already by influencing by Korean culture, by Western culture. So we are just focusing on that, like how Korean people like Korea has a basic, like massive influence on young teenagers especially. They have like developed some sort of like connection that how they are looking so beautiful all the time. Their body is perfect, why can't we are like them? So this is the social factor. Second, we have social media use again. Instagram has made everything, like social media has developed a lot of issues in teenagers. Mostly in teenagers, body image is the one of the topmost issues which which teenagers are developing, mostly girls. Because in social media everything is made to look perfect, but which is not obviously. But teenagers are very young, they don't know what is the behind the camera, so they just usually just focus on what is being shown to them. So this is the factor which is developing this concern, body image issues. They already think that they are not perfect, they are like ugly, they are not perfect like models, actors. Third is family social pressures. Our family has also the major role. By like we usually in our in Indian families, in Asian families, we already have seen like we usually taunt people who are little healthy, who are little dark skin. We are just taunt like them, nothing, they are nothing doing wrong in this, because obviously which is wrong. They are this creates a pressure in this. They think that they are ugly, they're born ugly. So they takes toll of their mental health, and this also leads to depression, stress in their life. So these are the three factors: biology, social, and psychology. For the next slide, we have eating disorder comparison between men and versus women. Whereas anorexia in men, which is only 5%, and anorexia in female is 95%. Bulimia, which is in males, is 20%, and in females it is 80%. Binge eating disorder, which is 50% in male and 50% in females. Why do you think anorexia and bulimia is high in females? Why do you think that? Anyone wants to answer this question? Jatin has raised his hand. Jatin, do you want to say something?
Hello.
Hello. Yes, Jatin.
Hi. I have one question. Whether these eating disorders are genetic or this is recent social element.
Sorry, your question is not clear. Can you please repeat?
Am I audible now?
Yeah, yeah, you are.
I wanted to know whether these eating disorders
Mm-hmm.
they are genetic or whether they are the recent social elements in our because of our social life.
See, there are what we have discussed in factors. There are issues. There are factors which led to you falling into eating disorder. Like biology is also the factor, psychology and social. So these three all are the factors. And people, if people are not like suffering from, like genetically they are do by, getting by social factors or by psychological factors, being a perfectionist or social or family pressure. So these three are the factors. We have to, when we take professional help, we will get to know that if we are suffering from genetically or biologically, psychologically or socially. Okay. So anybody wants to answer this question? Why do, Pragati, do you want to answer? Because I think you have answered in your chat box.
Yeah, I think it's more bulimia nervosa and anorexia nervosa is seen more in female because of the body image issues. Because in our culture, females are subjected to more scrutinization for their physical
Right.
appearance, and all the beauty pageants also there are a different kind of standards set for the beauty pageants contestant, female contestant compared to the male contestant.
Right.
Because I don't think in male beauty Mr. India like pageants, the male don't have to go to care for their hairs or smile or skin, which is in contrast to the female pageants contestant have to go through. So that's why.
Right, wonderful answer. That is the exact reason which Pragati has answered. Women usually fall into these eating disorder, anorexia and bulimia, especially because our society has made societal norms that women has to look perfect all the time. Women has to be slim. Women has to be fair. Women has to be take care of their body from top to toe, like from head to toe. This is the criteria we usually expect women to, there are certain, her smile should be very loving, she should be caring, she should be fairer, she should be tall. So these are the criteria. She should be especially thin in India. So these are the issues why women falls into more, because we as society, not only males, we as a women also judge them. Everyone judges, so they are more susceptible to fall into eating disorder criteria. Okay. So next, we have discussed factors, what is eating disorder, their types, their factors, and comparison between males and females. So now is treatment. How can we treat the eating disorder? First, the most utmost first is therapies. We have different set of therapies in eating disorder. First is psychotherapy, obviously, in which we counsel our client what factors led her or him to fall into this eating disorder. Next, we have family based therapy. If our family is also not supportive in this, then we have to counsel the family also, so that they can also understand what is about, because in India we don't have enough awareness about any disorder, not about just eating in of any disorder. So we have to counsel family therapy also. We have to consult nutritional therapy also, because in anorexia nervosa in or binge eating also, they have just lost their control and they're not getting track of their calories, because they're just like vomiting, they are, or they're doing overeating, or they're doing just rigorous exercises. This has just mismanagement in their calories. So we have to take nutritional counseling also. And then we have physical therapy, which will help you to do some exercises, but in a management way, in a balanced way. The way you are taking up the calories, the same way you have to do exercise also. Next, we have occupational therapy, in which you have to, we in a which therapist will look out what are you eating, in how much quantity are you eating, at what time are you eating. So in this you have to be 24/7 be with your therapist. You have to stay in a rehab, like, and then you have to, they perform the, because for some period of time you have to just live with them, so that they can see your daily routine, the structural routine, so that they can manage it, and then you can control, you can like out from this disorder. So these are the five therapies which are beneficial in eating disorder. With the help of therapies also, next we have medical treatment also, because without the help of medical we cannot get things get straight. So medical monitoring is also essential because obviously you have lost so much weight or you have increased so much weight. We have to now manage it and balance it. So this include, will be x-rays, there will be weight monitoring, there will be vital sign monitoring, because there will be blood test also, because when we lose weight excessively there, or we gain weight excessively, so there will be repercussions on the physical health. Like in anorexia we were seeing that it causes, bone density, decrease in bone density, teeth animals are, impacting, and weight, apart from weight all the things were getting impacted. So these are the things, your cardiovascular monitoring also, because from outside we are looking thin, but inside only with the help of medical treatment we will get to know what is happening inside our body. Dental evaluation and treatment, because your dental evaluation is also needed, because it is getting impacted during when you are, fasting, when you're suffering from anorexia or bulimia. And your cardiovascular monitoring also. So these are the things which help you in, coming out, which will help you to be, get treatment from medical treatment and psychotherapies, like therapies. So these will help you out to coming out from the eating disorder. All right, this is from my part. Thank you so much. Anything you want to ask or anything you want to add, anyone, please feel free to, yes, Pragati.
I have a question, Diksha.
Yes.
I have this peculiar tendency that when I get angry,
Okay.
then I stop eating. Okay.
Mm-hmm.
And it's not due to the fact that I'm angry, I'm not eating due to anger or to show my anger or ego, something like that. It's not like that. I have to stop eating in spite of being hungry, because at that time, the more means at that time, if I eat now, my anger increases. So to subside my anger, I have to give away my food. Means
Mm-hmm.
that's my in anger management strategy, you can say, because I've tried many times. It
Mm-hmm.
increases like every bite by bite. The more I eat, the more the anger increases. So what could be the reason behind this?
So, like you are asking that when you're angry, so you stop eating, whether you are hungry or not, you just stop eating, right? This is what you're
Yeah,
asking?
I consciously stop eating in spite of being hungry. Also, I
Hmm.
stop eating to subside my anger, because it increases. The more I eat, the more anger increases. That's why.
Okay. Okay. Yeah. So yes, in this it can be the reason, when we eat, or while we eating, or we do usually, if we are, whether the fact is you are eating sweets, it releases dopamine in our body. That is a second part. But when we are eating, our normal food, or that also causing, heat up inside our body, because when our eating a food, our digestive tract is in action, our whole body is in action, right? So this also increases our heat in the amount of our body, and which result in also, more anger also. In some people it has seen that, people who usually, eat spicy food, or normal food, they usually tend to get angry. It has also been seen that a spicy food also, increases anger, aggression in one person, in one individual. So it can also be the reason about, and some people have their own anger management technique also, because there must be, when we follow some, some a particular method or particular norm, there is a must be some reason for it. There is a must be a reason. So you have to know first that reason also. I think, according to me, is the food also causes, heating up in our body. First factor, and second factor is spicy food also, leads to increasing in aggression and anger in us. And when we develop a method, there's a reason for it. I think you should find that reason, right? Because the way you have developed this, that you are not eating food in getting angry, right? So there must be a reason why you have stopped eating food.
Okay. Okay, but
Yeah.
Diksha, usually it is seen in
Hmm.
people that if they're hungry, they tend to get more angry or irritated or
Yeah.
agitated. Usually, this trend is